All right, so we're joined by my friend Whitney Coleman, registered nurse, BSN, done it all. Graduate of Belhaven University, graduate of Terry High School, lived in Atlanta, Santa Monica, now Washington, D.C. We thank you so much for joining us. We're in the health science career cluster. We've got a room full here with us at Velma Jackson High School, and we're recording this for our friends at Ridgeland High School, Germantown High School, Rosa Scott, Madison Central, and the Academic Options Center. So thank you, as always. This is the third year you've joined us. We're always so glad to have you.
Thank you for having me.
All right. So before we get into all it is you do as a nurse, you graduated Terry High School, and then you went to nursing school at Belhaven, one of the first classes to come through Belhaven. So talk about that, because I think a big misconception is that nursing school is simple. We have a lot of kids that want to get into nursing because they see the high salaries, but they have no idea what goes into a nursing degree.
Excuse me, I'm sorry, my voice might be a little cracky this morning, but it's okay, we'll work through it. I went to a 4-year degree. So, you can have a 2-year nursing degree, and then you can have a 4-year where I received my bachelor's. Even if you have a 2-year degree, you can always go back for your 4-year. However, nursing school is difficult because it's a lot of studying. Even you might have an area of nursing that you might want to go into, say it's pediatric nursing, or it might be cardiac, or whatever the case, OR. Even though there's different fields of nursing, however, in school you have to study all of that. Nursing takes you through psychiatric nursing, so you have to, in a general sense, study the whole body. And there's a lot of components to it. Sometimes people say, well, I like nursing because I don't like the arts. I don't like anything like that. Belhaven actually made us discover all parts of the essence of nursing. It's not just giving medications and just, giving someone a shot. So no, it's about the even, you go through all parts of life as well. So it's communication, it's all of those things. So nursing school, you just have to really apply yourself. There was a lot of things that I might have missed, like parties and things that I couldn't attend, but it was well worth it in the end. Getting that degree was absolutely well worth it, because now I got to travel, and then now I get to reap the benefits of applying myself, because it does. No matter what school you go to, USM, there's other great nursing programs out there. Belhaven was one of the first, so we got to work a lot with our teachers in making the program what it was, and I was grateful for going to Belhaven. So, like I said, there's other good nursing programs out there, but wherever you go, you do have to apply yourself.
Yeah, and that's a good point too, because you talked about all the things that go into nursing school. I think it's important to understand from the jump whether somebody wants to do the medical assistant route, the CNA route, the RN LPN route. No matter what route it is, in this field, you're going to have to touch people. You're going to have to deal with bodily fluids. You're going to
Oh
have
yeah.
to deal with people that have some really gross injuries. You're going to have to deal with people that are extremely sick. You're going to have to deal with weird smells. You're going to have to deal with people that are very upset because people pass away. It is something that is very, very difficult. And on top of all that, like you said, you have to be able to communicate. You have to be able to write. When I just recently got out of the hospital, and my medical report for a 3-day stay was 29 pages. So
Mhm.
you are looking at a lot of paperwork, and you're also looking at being able to calm people down that may be nervous. So talk about all that, because I don't think a lot of kids understand the amount of that type of things you really have to deal with on a day-to-day in a health setting.
Well, I always say, if you don't like people, don't be a nurse. And in the nursing field, we also say you don't just take care of the patient, you take care of the family members too. You take care of everybody that is involved with that person. So communication is a big thing. I personally, I work in critical care, so it's a lot of education. Education is a big component. Patients ask, well, what medication are you giving me? Well, what is this? Well, you can't just say, hey, I have pills for you to take. You have to be able to communicate. They may be nervous. A lot of people still have a fear of doctors. Fear of doctors in the medical field is one of the top 5 common phobias people have. So you have to be
Yeah.
prepared to just be able to be calm and just properly, not only be there to heal the person, but you have to be able to be, I guess, a connection piece between the doctors, a liaison, I should say, between the doctors and between the family members. So yeah, it's, and no matter, like I said, no matter what field you're working in, you have to be able to kind of be, we're kind of like the connection piece between all the other teams that work together.
Yeah, and that's what I want to talk about next. That's a great segue because we may have some people that say, "Look, I want to work in health science, but I'm not really a school type person, or I want to focus more on the technology side." So, what are some other areas? We mentioned a couple of them: the medical assistants, the CNAs, but there's also techs that have to run the machines, to run the CT scans, to run the sonograms, to run, health informatics is a big one right now. So, what are some other areas that kids could get into, even if they don't want to do the full nursing degree?
So the hospital is designed, it's you have different teams that, like you said, that work together. So you have radiology tech. Some people go into it and say, well, I don't want to do nursing, but I really like to run the CT scans, the MRI, the big MRI machines doing scans. You could be a radiology tech, or you could go into radiology itself and become a radiologist. You do have respiratory. We have a big component of what we do is our respiratory tech. Some people actually like that. I really suggest a lot of people to, I was a CNA first. I worked at St. Dominic's as a CNA for 3 years. And I suggest people do a CNA. If you want to go in the NICU, uh, apply, do teching in NICU, just to get a field. And you might say that you don't want to do that. There's phlebotomy, you could always
Yep.
start a phlebotomy. You could do that. I think even with a 2 year, or they will train you before you're actually a nurse or whatever you want to do. There's physician's assistant. You don't always have to be a nurse. You can go into, let's see, gosh, there's just so many things that there's speech pathology. All of our stroke patients sometimes need speech physical therapy is also a big component of what we do to rehabilitate. A lot of people like to do sports physical therapy. I think that's like a popular thing, but we also have a big physical therapy component in the hospital, occupational therapy. My sister is actually an occupational therapist, and she enjoys rehabilitating. They actually have a really cool room. When you go, they have like a car simulator. You're teaching people how to drive again. Those
Yep.
things our stroke patients need to learn how to integrate back into the real world, because they lost a component of their brain function, and now they have to learn how to tie their shoe again. And it's kind of cool to see the transition. So there's other things other than nursing, and it's fun to see people come in, and dietary nutritionists, things that we don't really think about, that goes into it. So it's different teams,
Yeah.
interdisciplinary team. Mm-hmm.
Yeah, and there's different levels of education you need. A good friend of mine did the physical therapy assistant program at Hines, and he was done in 3 semesters, and he's making pretty
Yeah.
good money as a PT assistant. He's getting to work. He's the one really getting to work day to day with the people recovering from injuries. The physical therapist does design a lot of the things, but if you really want that human interaction and the rewarding aspect, and you mentioned the PA as well, that's a very popular field. USM just got a PA program that is really taken off. So there are a lot of areas. We hear nurse because that's the most popular, but it's not the only way to work in health science. And there's a lot of rewarding and very needed jobs, especially since COVID. You mentioned the respiratory, that is really, really needing some people to get into it. Now, something else I like to talk about too is there is a big need and a big push for men to get into nursing right now. It's not just a female job. And I hear a lot of females say, look, we need more men to get into this because sometimes we have patients that are more comfortable talking to men. Other times we really need to move somebody that's difficult to move, and we need a male to help us with that. So talk about that, because I think we're seeing a little bit more of that, but there's still a big need for men to look into nursing.
We love our guys who are nursing. One of the things that people don't think about is cultural. Um, Even while traveling, and I'm so happy that I have been able to get out of my own comfort zone. We're so used to our Southern culture, but when you come out and you have the Muslims, people who are other cultures that say, I don't want a woman to look at me, that's totally fine and that's within their rights. And sometimes we're searching for men to say, hey, we need you might hear things like Foley catheters, or we have a bath to give. And in their culture, a woman is not supposed to bathe me, and we have to respect that. And there's other aspects of it too. Some people are just more, they say, oh, well, you women are so frantic. I mean, there's some people who are just more comfortable with the man, and I think that they should not be afraid to go into nursing, because it is, I mean, it's 2023. You would think that we got over that, but we haven't. But it's not a woman's field. And then plus, a lot of people use the nursing to as a bridgeway to other, you
Yeah.
know um, careers. As myself, I got into nurse practitioner at Vanderbilt. So, and then I have a good friend who's a male, and he's using it to bridgeway into physician assistant. So that's why I
Wow.
brought that up. So yeah, guys, please, yeah, go into nursing school. You'd be surprised. It's a lot of reward, and sometimes we like to see a breath of fresh air in men going into nursing as well. So yeah.
Yeah, and a good friend of mine who was in the NICU at UMC, he's a nurse practitioner in Huntsville now and making some great money. And he
Mhm.
specializes in prenatal emergencies. And he has never gone to medical school, never did the MD, been a nurse and making great money. He has been able to raise a family and everything. So there are a lot of opportunities for men in this area. Now, something else you mentioned, and I hear a lot of kids say this, especially here, they talk about they want to get into nursing and they want to travel. So
Yes.
you've been in Santa Monica, you've been in Atlanta, and now you're in Washington, D.C. So you've been in some pretty cool areas, some great medical areas with some state-of-the-art hospitals, but it's a competitive field. It's not just something you can just sign up and say, hey, I want to travel. So talk about how all that works and how those contracts work and how somebody may get into that. Because there's also traveling CNAs, there's traveling respiratory
Yes.
therapists. So
Mhm.
talk about how all that works, because I think a lot of kids don't really understand that.
Um, so COVID was a blessing in a way. There was a silver lining because it opened up a lot of travel, like you said, a travel positions, not just for nursing, but for pretty much whatever you want to do. Um, a lot of it is you do have to apply yourself. Like I said, my minimal experience was 2 years, which goes by really, really fast. People say, oh, I have to work in one place for 2 years, but it actually goes by really, really quickly. And so I had to have a certain amount of experience before going to travel. And a lot of it is just liability reasons. And they just want to make sure that, hey, you're in a new area. So you have to be, and one of it is being able to adapt to change, and to being able to apply yourself in a new area. We always say nursing is the same. It's just being able to adapt to maybe different hospital or policies and things like that. And you kind of get an orientation to their hospital. So essentially, what I do as a nurse does not change because the care that I give will be consistent, whether I'm in Hong Kong or if I'm back in Jackson. But you just have to, a lot of the times they're looking for, do you know what you're doing and can you apply yourself? Because here it's going to be different, and it has been different in different cities, but mainly they just want to know how well can you adapt. And then it also goes into my personal, I'm happy that I've done this because now as a person I can apply the things that I've learned and the different cultures that I've come across. And, it's not just in my career, but I'm happy to venture out. I started my career in Baton Rouge, Louisiana, at Baton Rouge General as a nurse. And there I was staff. And from there, I traveled. And so starting at St. Dominic's, I was able to apply myself in different places.
Yeah, and that's a good point too. And I've seen a lot of people do that. They work their way up the ranks. And I know St. Dominic is a great place to work because they will train people in other areas. Like you talked about a phlebotomist. You get a phlebotomy certification, you do a great job. St. Dominic will train you to be a blood lab tech where you're getting paid a little bit more and you're doing a little bit more technical work. So there are a lot of areas that don't necessarily require the 4 to 5 years, or and then also, the CNA, you're going to learn the nursing stuff. So nursing school is a little bit easier for you. Or if you want to do the MD, be a nurse first. Medical school will be a little bit easier for you. Now, one thing you did mention before I get to the students' questions is you talked about how nursing transfers. So when you become a doctor, which I know a lot of kids say, I want to be a doctor because they see the high salary and they think they're making a difference, and they are, and we need doctors. But when you're a doctor, you are locked into a specialty. It is very, very tough to change specialties as a doctor. But as a nurse, If you get sick of working in a certain specialty, it's not that much of a learning curve to change something. Now, obviously, some people stay in the same areas for years, but if you're a NICU nurse and you're like, I don't want to see little kids die anymore, I want to do something else, you could go work somewhere else in a different department. So talk about how transferable nursing is among disciplines.
I think that's the one thing I like about my career. Now, personally, I love ICU. But if you don't, I have plenty. I have one friend. Her name is Sarvi. She's down in Mother Baby. She said, "I'm tired of ICU. I'm tired of seeing the stressful things," and so it is transferable. It's not only transferable, but it's also you can climb the hierarchy. So again, like you said, first of all, being transferable, if you want to go into the OR and see surgeries, you can absolutely do that. If you want to work on the floor to recover surgery patients, you can do that. PACU, I mean, the sky's the limit. You can go to a clinic and you can do outpatient surgery. You can go to a plastic surgery. I mean, to be honest, the sky's the limit. And now nursing, for example, I just opened up a CPR business. I'm actually using my nursing to teach CPR to other people. So you could kind of actually think outside the box. And then, like I said, and then now not only is it transferable, nursing is, you can kind of climb the hierarchy. So I started as the CNA during nursing school, which gave me an idea of what I wanted to do. And then now I'm in school to be a nurse practitioner. And while I'm going to get my master's, I'm also going to get my doctorate. So I will, by the time I finish Vanderbilt, I will have my doctorates in nursing, which actually means that I can prescribe prescriptions. You know, I can work alongside doctors independently, depending on what I want to do. So it's not only transferable, but it's, you can climb the hierarchy and you don't have to stay. If you don't want to just be an RN, or you could do physician's assistant, or you could just go back to medical school. But the field of nurse practitioner now is actually growing to where we can also be independent. Some clients, some patients prefer just seeing nurse practitioners. And so that's one of the things that I do appreciate, that I don't have to go back for 8 years to do the same thing I've been doing for a few years.
I almost forgot. I do want to ask one more thing before I get to these questions. Is obviously I mentioned health informatics. The advances in technology and healthcare are growing every day, and that's another reason we really need young people to look into getting to health science, because even if they never deal with patient care, the need for technology savvy people and software people, IT people, techs on these machines is not going to end, because every month something new's coming out and they need people that know how to program. So talk about the technology skills that you're seeing, because that's a big deal right now.
A big part, there's two components of that. One of it is we do have a huge, every hospital that I work has a huge IT team, because our health informatics, a lot of the things now, what we do is on computer. When people hear charting, they're like, usually you see in nursing homes, it's writing, it's old school, but in the hospitals, it's we call EMR, it's electronic charting. And without our IT team, we're tiger texting. You'll hear tiger texting the doctors, and if one of our system goes down, getting information to the caseworkers to help patients, transition out of the hospital. IT team, health coding. It's starting to become a big thing. You could actually health code. So the people that we don't see, they do play a big role as to coding, hey, this is the prescription, this is the software. So a lot of that even goes into it. So you don't even have to be medically minded, but our software, our IT people are good. I will say this, research, the field of research. There's a lot of people who don't want to touch patients, but they say, I want to I'm interested in why is the diabetes epidemics still so bad in this community. And we have a lot of good people who go into health science in the research team, and then they work alongside of the doctors. We may not always see them, but they work alongside of the doctors. And research is actually a big thing. And people actually get paid a lot of money to go into the labs and do the research component. And then you get a lot of PhDs and stuff that come out of the research field too. So you may not like to touch the blood, but IT and research are definitely a big thing.
Yeah, and another thing on that is in our STEM class, we've talked about the health AI and why that is such a need for diversity. Because when you look at And there's a book about it called Unconscious Bias. Now, that doesn't mean people doing the AI are racist or evil or mean, but they're not going to understand certain health issues in Black communities or with females. So there needs to be a diverse group of people programming these machines that are going to see symptoms. So when somebody is sick and symptoms are plugged in, if there's any type of unconscious bias, something could fall through the cracks. And that, and that what causes generational health problems. So that is another big thing that I wish everybody would look into, because there's a need for diversity, not just on the patient side, but on the IT side as well.
Mm-hmm. Absolutely. And I think that's really big. A lot of hospitals right now are launching big diversity programs. I actually, to my benefit, when I went out to California and here, a lot of the doctors that I work with are actually happy that, hey, you're from the South, you're Black, and it's not um, to pinpoint me out, but there's some doctors that who are interested in, like I said, the diabetes epidemic, but because I know where the area that I'm from and the things that you normally see, I give a different perspective, and that's what a lot of doctors are looking for. So a lot of times you can use your diversity, the Latinx community, different minority communities are definitely needed, because we have an input from the things that just personally, I've seen my grandmother go through this. I've seen, uncle go through this. And then we have different perspectives that we do contribute. So a lot of times I have learned that where I'm from, I do give a different perspective, and it's actually needed in different areas of healthcare. So I do encourage people to.
Absolutely. Well, I got some questions from the students. I'll get to as many of these as I can. These are all ninth graders. This first one is Kyman Dawson, and this is a great question. He asked, what qualities do you think makes a great nurse?
Oh, that's a good question. Empathy, empathetic. I think that's one of the good qualities you have. Sometimes people go through things that you've never heard of, or we hear crazy stories all the time. But a lot of times you have to look, learn to remove yourself and be empathetic. We always say kind and caring, but I think empathetic and great communication are one of the two things that people usually always remember. Because sympathy, you can feel sorry for someone, but a lot of times people just say, hey, look, I'm hurting. Just feel my pain and be with me in that moment. So I think having good communication, empathy, and of course, being kind and caring is good as well.
Absolutely. I like this one. This is Leah Smith, one of our volleyball players here. And she asked, as a child, did you always want to know you wanted to go into nursing? And what made you choose nursing as opposed to other health fields?
So as a child, I was around a lot of nurses. My mom was a nurse. My mom actually went back to medical school. My grandmother was a nurse. And one of the things that stood out to me, even as a child, was, me and my dad would be in the grocery store and someone would say, hey, you took care of my mom. And maybe it was 10 years ago, but I'm like, wow, people really remember what you do for them. And so and maybe sometimes it's the small things that you do to make a change. People remember CNAs in the same way, whatever field that you go into. So I did always know that I wanted to be a nurse, and to use my nursing to the best of my ability. So I did.
That's awesome. This is Trayvon Willis, one of our football players here. And he asked, what kept you motivated during adversity you faced during nursing school?
Oh, um, what kept me motivated was the end goal. Even as a CNA, I was able to kind of see the other nurses work, and I'm like, yep, that's going to be me one day. So during school, even though school was hard, seeing the end goal, always having the end goal in mind, I was like, okay, yeah, this is what I want to do, and being also surrounding yourself with like-minded people. Nursing school, you kind of have the struggle with everyone, so you are able to get through with everyone too. So my friends also helped me, our study groups and stuff, because nobody feels your pain like other nursing students. Yeah.
Absolutely. And I would also suggest, and I know you did this in high school, for people that are interested in getting into any type of health field right out of high school, that fourth year of high school, take that extra science and that extra math. I think that would be invaluable, because, a lot of kids want to skimp their senior year and want to take it easy, but that can really hurt you if you wanted to get into a field like this.
Yeah, look into you have different like ADN programs like Hines and stuff that will allow you to do like a course, an extra course, if it would kill you to do an extra hour on Mondays and Wednesdays. I would say take that extra one because it looks good on your resume. I'm still using my resume to this day. Even transferring into dermatology, which I will eventually go into.
Wow.
um People are like, let's see that resume. So, I will say your resume carries. This is the time now that you guys are in high school. This is now your career. I know high school is supposed to be fun and let it be fun. But also, this is the time to be thinking, okay, what do I want to present to my future uh, people who are my boss or my future? This is the time to start presenting yourself. So yes, take that extra class. It does look good. Senior year, what's the extra hour that you might be doing something else? You have the rest of your day to enjoy your day. Do it.
Absolutely. I love this one. This is Samaya Williamson, one of our basketball and volleyball players here. And she asked, what is the most rewarding part about nursing?
The most rewarding part is when when we see patients get better, and when they remember, oh, I remember you took care of me. And sometimes it's the glass of water you gave to them, because you have to think, when people are ill, they're feeling bad. A lot of times they don't even want people in their face. So the most rewarding part is when people are on the other side and they're feeling better and they're like, yeah, I remember you. Sometimes we get flowers, the gifts, they are really nice, but sometimes they're a remembrance of, and sometimes you even forget about that patient. And then when you get a package that comes in a hospital from a patient that remembers you, that's actually a really, really good feeling. Nurses Week, we usually have a good time during Nurses Week. All the gifts and the love you receive and the credit, it's a good feeling.
Oh, absolutely. Now, I've got one more from the students, and this is a great one too. This is Ashton Garrett, one of our football players. And I think this is important when it comes to nursing. But he asked, what level of dedication do you have to be working in this field? Or do you have to have
Oh,
working in this field?
you have to have all the dedication, as much dedication as you can give, because I will say some days it's tiring. Some days you come across difficult people. Everybody's not going to be like you. So if you're not dedicated, they say if you don't like what you do, it's a job. So you have to like what you do. And so you do have to be dedicated. And again, that's going through the transference or the climbing the ladder, because it's always about learning and applying yourself. But like I said, the dedication that I give to my job also reflects in my personal life too. So as long as you're dedicated and you stick to it, just like football, it'll take you far.
Awesome. Now we're almost out of time, and as always, we thank you so much for joining us. Just such a cool story and such a great field for everybody to look into, and just such a great perspective. But before we go, you grew up as a black woman in Mississippi. You face the same obstacles these kids face, but you've done the big city life, and you're doing it now in our nation's capital. So obviously, great things can happen in this field. So first of all, why does health science need these young people to look into it, and how can they overcome those same obstacles?
Um, First of all, well, we need you guys because you're living it. Just because you haven't been to school, you guys have seen stuff. Like I said, at home and in your career, or not, well, in your young career. So there's stuff that might mean something to you right now that I had a friend who had a cleft lip palate as a baby, and now she's a neonatal NICU nurse because that's
Wow.
something um, that she experienced as a baby. So, you have things that are important to you. So I would say hold on to those and use those as motivators. And then also overcoming any cities like any other, all city has crime, all city has different things. And so it was easy for me to adapt because for me personally, I like change. And if you're that person, I'm never ashamed of where I come from. I tell people all the time that I'm from Jackson, and all, being from Jackson has, like I said, has helped me because a lot of people think of Mississippi still, unfortunately. Oh, well, I didn't think Mississippi had this, and I'm able to educate people, and they're like, oh, people like you have come from Jackson. So, um, I'm able to diversify even the areas in the cities that I work in too. And then I'm able to bring home what I learned as well. So
Absolutely. Well, again, we thank you so much for joining us, and we'll see you at the Camden Elementary Career Fair coming up in a couple of weeks. We're glad to have you at that as well. But if anybody has any questions, this is such a great person to talk to. And if anybody watching now or watching later has any questions, I'll make sure I forward them on to you, because this is such a hot field, such a needed field, and such a great and rewarding field to get into. But Whitney Coleman, who's in Washington, D.C., but joined us right down the road in Terry. Thank you so much for joining us today.
thank you.
All right, buddy. I'll talk to you soon.
Okay. All right.
See ya.
Bye.